In the essay Medicine by Linda Villarosa and the book The 1619 Project by Nicole Hannah Jones speaks on how the field of medicine is deeply rooted in the beliefs of slavery and prejudice, which provides a false idea that black people have different biology than white people, when in reality we are all the same. This leads to tragic outcomes for many black Americans who seek medical assistance. It's designed to fail us, and many examples give evidence for this conclusion, one of which is Alexander Morris, a former member of the Four Tops. Before being diagnosed with a heart infection and pneumonia, he has serious symptoms, and despite those serious symptoms, staff allegedly restrained him, turned off his oxygen, and delayed his treatment. The chapter Medicine by Linda Villarosa exemplifies how black patients often receive substandard care due to enduring stereotypes, like the false belief that black people's skin is thicker than white people's. Villarosa begins the essay with a primary example of prejudice against a black American, Susan Moore, who is a physician that had a case of COVID-19. She checked into her local hospital and was treated by a white physician. He didn't fulfill his duties as a physician, and she passed away 2 weeks later at 53 years of age. The essay addresses current discrepancies like how black Americans have higher rates of maternal mortality, chronic diseases, and receive significantly worse health care compared to white Americans. She argues that these outcomes are not due to genetic or personal choices, but really systemic racism in the healthcare system.
Villarosa touches on how formerly celebrated men like Thomas Hamilton and J. Marion Sims used inhumane techniques to experiment with enslaved men and women to study their bodies. Hamilton was obsessed with proving that black people have thicker skin than white people and experimented on a man named John Brown. Hamilton experimented on him so much and in so many different places on his body that he was useless in the field. Even after slavery ended, the abuse of black people under the guise of advancing medical discovery would continue. The Tuskegee study of untreated syphilis in the Negro male was a study conducted on more than 600 Alabama men and 399 who had syphilis. They never received any treatment and were described as bad blood. The government clinicians ignored the pain and suffering and allowed the disease to advance. After one man died, his body was autopsied to compile the data on the ravages of the disease. A common narrative nowadays is that the system has failed black people, but Villarosa reveals what the real narrative should be. If a system was never originally designed to help us, how could it have failed us?
The content of this specific essay is centered around the idea that structural racism is very dominant in the field of medicine. Birthed at the start of slavery, it has left a mark on America that cannot be hidden. In our present day, as black people go to receive medical attention, and biases against black people often become harmful stereotypes that affect their health and well-being when doing so. In the article, How Present-Day Health Disparities for Black People Are Linked to Past Policies and Events, published by KFF.org, touches on the topic of how when black people need to seek medical assistance, they are more hesitant to do so. Health insurance rates and even access to quality health care poses an ongoing issue. Imagine suffering because you are not able to afford something that should be a basic human right. Even in the lower income black communities, the healthcare providers and treatment they are exposed to is unfavorable, making the affordable healthcare they do receive not nearly as sufficient in resources and patient care than hospitals and pharmacies in white communities. In a nationwide poll found by KFF as well, there was a study done that showed 7 in 10 black people reported saying they have been treated unfairly, and 55 saying they distrust it. But these responses do not come out of nowhere. They are a product of what the doctors who would heinously operate on men and women during slavery centuries ago would do.
Linda Villarosa used to emphasize this is the continuous saying of "this is how black people get killed" throughout the essay. Almost every time she made a connection to our current treatment of black to white physicians years ago, she used that phrase to make her audience aware of the fact that these current practices taught in medicine are ways that many black men and women like Susan Moore got killed. Another strategy used by Villarosa is historical references. By referring back to medical practices done to the enslaved people, she allows the audience to connect this past belief to the medical beliefs about black people today. In order to show the absurdity of medical biases, she connects to where biases like African Americans' lack of pain tolerance are rooted, given detailed description of the operation, and experiments performed on the enslaved people without any painkiller.